Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. It is Tuesday, April 13th, and this morning we learned that there is a pause on Johnson & Johnson COVID-19 vaccines because of a very rare blood clot reaction that some women are experiencing right now. Joining us is Dr. Mysheika Roberts, Columbus Public Health Commissioner, talking about that pause and how it is affecting us here in the city of Columbus and what that means. I know, Dr. Roberts, Tuesday, usually the Johnson & Johnson vaccine day at the fairgrounds. How are you guys adjusting?
Yeah, so obviously we're compliant with the pause that CDC and the FDA advised. And we informed everyone who was scheduled to come to the fairgrounds today to get that Johnson & Johnson vaccine that it would not be available and they could still come get a vaccine, but it would be the Pfizer vaccine instead of the Johnson & Johnson vaccine.
Have you heard from the public? What has their reaction been like? And has there been any hesitancy because of the pause in one of the three vaccines that are available right now?
Well, we know when we sent the message out to about 3,000 individuals who were scheduled to get the J&J vaccine today, that 250 of them canceled their appointments right then and there. I don't know why, if they were adamant to get the J&J and didn't want another vaccine, or just had some general skepticism about the vaccines in general. But I will tell you that the Pfizer and Moderna vaccines are safe vaccines. They're made on a different format than the J&J vaccine, and the observations that have been observed with the J&J vaccine has not been observed with individuals who received the Moderna nor the Pfizer vaccine.
Those 250 people who did cancel, is that concerning to you in making sure that we are getting all of our Columbus and Franklin County residents vaccinated quickly?
Well, I am concerned that this is going to slow us down in getting individuals vaccinated in our community. We will now have less vaccine available to those who want and need this vaccine by removing one brand off of the market. So I am concerned that it's going to take us a longer period of time to get those vaccinated.
How is that going to affect you guys in the long term? Have you started thinking logistically about future plans and future vaccination days? I know a lot of people, especially, we're going to be hitting that 3 week mark, especially of the when it was open up to 16 and older.
Well, fortunately, it was not the only vaccine product that we had here in Ohio or here in Franklin County, but again, it's going to slow us down. And so we're going to have to rethink some of the outreach clinics we have and be prepared to go back a second time, because we're going to need to use Pfizer instead of J&J. So it definitely will slow the progress that we've been making here in Franklin County, here in Ohio, and really across the nation by removing this product from one of the options that individuals have.
As a physician, can you explain the reaction, the blood clot reaction people are having, so we can kind of understand it a little bit better in layman's kind of terms?
Sure. So this is not only are individuals having a blood clot, but they're also experiencing low platelet counts in their body. And so it's more than just the average stroke. It's a syndrome of the clot that occurs in the sinus veins of your head or your brain. And then the individual also has a low platelet count. Platelets are what we need in our blood to stop bleeding. So if you're bleeding somewhere, platelets go to that spot and try to control the bleeding. So when you have a combination of these two, with clots and a low platelet count, that can be devastating. And as we've heard, one individual has lost their life. We have to keep in mind, though, that in general, this condition usually occurs 5 times for every 1 million people. And what we've seen with the J&J vaccine is it has occurred 6 times, with about 6.8 million people being vaccinated. But it has occurred enough to make pause for FDA and CDC. And so we want to all learn more about that before we proceed with using this vaccine again.
Certainly. For those of you people who have already gotten the J&J vaccine, what do they need to look out for, and in what time frame do they need to look out for it?
Sure. So the guidance that we've heard from the CDC is the individuals who have presented with these symptoms presented within 2 weeks of getting the vaccine. But the guidance from CDC is anyone who's received the J&J vaccine within the last 3 weeks. So if you're within 3 weeks of receiving the vaccine, You should pay attention to your body. If you have a headache that doesn't seem to go away, if you have a change in your vision, if you have some nausea or vomiting that doesn't seem to be controlled, if you have swelling in your legs, your lower extremities, that could be a sign of a blood clot. You should seek medical attention immediately. And that shouldn't be calling your doctor. It should be going to an urgent care or an ER and informing that your healthcare provider that you did receive the Johnson and Johnson vaccine and on what date you received that vaccine.
Okay. What I guess are doctors supposed to be doing? Are they notifying their patients? Are you guys notifying people that you guys have given Johnson and Johnson vaccines to? Just what kind of communication is there for the general public if they aren't, watching the news or something like that?
Yeah, it's a great question. And so we are all just learning about this, a few hours ago. So we're in the process of determining how we can best communicate with those who we know we provided the Johnson and Johnson vaccine to.
Now, I think it might be a silly question, but one that might need to be answered. If you did receive it, does this side effect, this very serious side effect, does it affect the efficacy of the Johnson and Johnson vaccine at all? Are people who did get it and didn't get any side effects, such as the low platelets and the blood clot, are they at any other risk, and are they still protected from the virus?
That's a great question. And the efficacy of the vaccine has not changed whatsoever. So the vaccine is still effective at preventing or reducing your chances of getting COVID-19 and preventing hospitalization and death from COVID-19. So this is a adverse event that has happened after getting the vaccine, but is not making any impact on the efficacy of the vaccine.
Okay, I don't want to keep you for too long. I know it's a busy day for you. What else does the public need to know about the vaccine process and scheduling appointments and the efficacy and all of that? What's your message to Columbus and Central Ohio about getting vaccinated at this point?
Yeah, so I don't want people to panic. I want to remind people that we had three vaccines on the market, and now one of them has taken a pause. We still have two very safe and effective vaccines that are made out of very different platforms than the Johnson and Johnson vaccine. And so we still have vaccine available here for people who want to get vaccinated against COVID-19.
And I guess I should ask you this: how many doses of Johnson and Johnson did you guys have on hand for today or for the next few weeks? And how many were you expecting to get? How many vaccines, how many shots is this going to put us behind potentially?
Sure. So we have approximately 7,000 doses of Johnson and Johnson on hand right now, which we were prepared to give out this week and the remainder of next week.
Mm.
So we're going to be short 7,000 vaccines as of right now. So we'll need to try to make that up with getting more Pfizer, at least for us here at Columbus Public Health.